So just to introduce myself, I'm Annie Hudson and I'm chair of the English Child Safeguarding Practice Review Panel. And I don't quite know where the title of this particular session went, but it's really the primary purpose is to talk to you a bit about some work we're doing in the panel around child sexual abuse in the family environment. So I'm going to do three things. Firstly, just to tell those of you not terribly familiar with the panel, just to describe the work that we're doing, and then to talk a bit about the drivers for this national review we're undertaking about sexual abuse in the family environment, something about the context of that work and the kind of evidence that we've had, and then segueing into the sort of third bit, which is just to talk to you about what the national review, what it's focusing on. It's a review that's ongoing, so we don't yet have the findings and recommendations. And then I'm going to, so this bit's, I think, being live streamed, or whatever the right phrase is. And then we're stopping and I'm going to hand over to my colleague, Glenn. Do you want to introduce yourself?
Yeah, Glenn Pounder from Scouting America. I'll explain why I have an English accent a little bit later.
So, okay. So, just actually to hands up who is familiar with what the work of the English National Panel. So some of you, but I'm going to, if you can bear it, I'm just going to talk a little bit first about what the panel does. So we are an independent body, and we are, those of us, and I'll show you pictures of us in a minute, those of us on the panel, we're appointed by the Secretary of State for Education, who within English government has the lead on child safeguarding. But we are an independent expert panel, multidisciplinary, multi-agency, and we have a number of tasks, but one of which is to commission national reviews of, in the language, serious safeguarding cases, what is really meant by that, particular sort of themes or issues, sometimes about individual children, but sometimes more sort of generic themes relating to child safeguarding and child protection. We have our own statutory powers, we're independent of government, as I've said, and we also, as well as commissioning our own work, we also review local reviews, so local rapid reviews and child safeguarding practice reviews. The sort of legislative basis for the panel is the Children and Social Work Act 2017, which created a very different and much more multi-agency, multidisciplinary system around, at a local level and national level, around safeguarding children. And the panel was set up really to encourage better learning and better improvement from situations where things have gone wrong for children and they've been seriously harmed or died, and trying to get away from a kind of sort of blame culture which it was felt the sort of previous regimes sort of tended to inculcate. So that's us. We include, so we have a paediatrician, we have a police person, Ian Critchley, some of you will know from currently with the National Police Chief Council. Then we have colleagues from health, local authority, the voluntary sector, legal, the Chief Social Worker for England, and so on. And basically we do three things. We maintain oversight of that system of local reviews, so we give feedback to local areas when they produce their local reviews, but we also commission national reviews, and I'll say something about that in a second. And then from that, and looking at that kind of massive evidence, we get about 400 reviews that we look at every year. Our function is to really identify the practice and policy issues that arise that are maybe quite complex or of national significance, and may make recommendations to government, or we may make recommendations to local safeguarding partners, so that with others, many others, including Director of Children's Services, Chief Constables, senior police officers, senior people in health, and of course practitioners, identify the improvements that are needed to help better protect children from harm. So in terms of our national reviews, the two most recent ones, one we did about, it's called Child Protection in England, where we looked at the circumstances around the death of two young children, Arthur Labinjo Hughes and Star Hobson, who had both died in 2020, and we produced a report in 2022 which was, as well as talking about what had happened to those children, was really trying to aggregate from what had happened to them and wider evidence that the panel has, what it was about the system that needed to change to better protect children in the future. So one of the main recommendations about that, and which is now being trialled within a Pathfinder programme in England, is a multi-agency child protection team. So bringing together police, health, local authority, children's services, probation and others to work together as one team rather than having that sort of siloed kind of organisational design that in many respects we still have in this country, despite, you know, working together on other kind of policy initiatives. A second review we did and we produced a report last year, was about children with disabilities and complex health needs who've been abused, a large number of them, over 100 children, in 3 residential settings run by a private provider, the Hesley organisation, and those homes which were based in Doncaster. And again, producing a number of recommendations to government about how the system of oversight and commissioning of those kind of placements and protecting those children needed to change and improve. So all in all, the kind of, you know, the best way of describing the panel is that I think we seek to be a bit of a weather vane about the system and the health of the system, what's working, what's not working, on the basis of those reviews that we see every week. So to sort of move into just talking more specifically about the panel's perspectives on child sexual abuse and child sexual exploitation, before I kind of explain why we decided to undertake a national review. I mean, there has been in different places a lot of attention in certainly in England and as in other countries around sexual abuse and exploitation. So most recently in England, we've had the independent inquiry into child sexual abuse, which I suppose primarily focused on abuse of children, sexual abuse of children in institutions, so residential homes, schools, within other institutions like, you know, the Catholic Church, Church of England and so on. And in fact, in my previous role as the Director of Children's Services in Lambeth, had to give evidence to that inquiry about the sort of scandal, really, of, you know, almost industrial scale child sexual abuse of children in a lot of different homes in Lambeth in the 70s, 80s and 80s. So the focus of ICSA was very much about abuse of children, particularly in institutions, from the past, and trying to extrapolate from that in order to kind of identify learning for the present in terms of policy. Obviously, we've got mandatory reporting going through Parliament and so on as just one of those recommendations. So I think that kind of gave a focus on certain aspects of child sexual abuse. And then we've also, and I'm going to talk about the second review there, in our Safeguarding Children with Disabilities, there was certainly evidence in what happened to these children in these homes in Doncaster. Some of them were sexually abused. And then there's been a lot of analysis done by VKPP, so the Vulnerability Knowledge and Public Protection Analysis, so a police-led organisation, about recorded child sexual abuse and exploitation. And we know that there's been exponential rise in the kind of numbers of recorded crimes around sexual abuse, including peer-on-peer abuse, online abuse, and, of course, child sexual abuse in the family environment. What's quite interesting, and this is the bottom point really, is that despite that kind of backdrop, particularly of ICSA and kind of heightened awareness through you know, various bits of analysis and criminal statistics, if you look at the percentage of children who are on child protection plans, this is just England, I recognise, who are under the category of child sexual abuse, and there are 4 categories: emotional abuse, neglect, physical abuse and sexual abuse. Only 4% of children who are on a child protection plan in England are on the category of child sexual abuse, and that's the Centre, I'm not sure if Ian's here, the Centre for Child Sexual Expertise on Child Sexual Abuse who got that category. And what's more interesting, or even more worrying really, is that percentage has dropped. So there's something going on in terms of the multi-agency system of responding to children who are being sexually abused in their family environment, that there's almost like less children seem to be on the kind of radar of the system. And I'll come back to why that might be so in a moment. Because it's not that children are no longer being sexually abused. In fact, what I think does happen is that sometimes there is a reluctance to place a child as being on a plan for that reason, and instead to go to something like emotional abuse or neglect, which may mask our understanding of the prevalence of sexual abuse in families. What we also know is that in terms of the serious incident notification, which is what drives local areas to do reviews, we have relatively few coming through to us on the panel about child sexual exploitation. And that in itself is a kind of a source of worry and concern. And is that, why is that so? Because it's not the case that there are, that again, children are not being sexually exploited in different sorts of ways and different kinds of contexts outside of the home. So despite all the kind of work that's gone on through ICSA and other kind of forums, we still, in terms of those kind of figures, it would suggest that we don't have a real grip on the profile and response to child sexual abuse. What's also quite interesting, and we were talking about this in a previous session, is that we see in the panel relatively few serious incidents where online harm is seen to have been a kind of important feature or characteristic of what's happened to a child. And again, we think that that's reflective of very significant underreporting. So what we do have, and this is what's driven our national review, and for us to undertake a national review, which we'll report later this year in the autumn, because of course we're bound by elections and all of that, but somewhere in the autumn we will publish this review. But as a panel, there are many features of reviews that come to us about sexual abuse in the family environment. And the family environment is a phrase we've used purposely to encompass children, for example, who are being abused in a foster placement. So it's children who are living in a family context, not residential homes and not familially. And these are just some of the things that we've kind of noticed in terms of, patterns in practice. So the first thing is, there is that continuation of professionals operating with certain kind of prejudice and bias and stereotypes and myths about child sexual abuse. And in some ways, I find this deeply shocking because in the sort of late 80s, 90s, I was very involved in doing some kind of research and working in a voluntary organisation which was focused on sexual abuse in the family. And we talked then about the kind of myths, the myths about children having choice, the myths about the dangerous people were people who were kind of, dirty old men in raincoats, all that kind of very traditional ways of understanding and making sense of child sexual abuse. And that it's almost like if a perpetrator will have that sort of written on their forehead. And I think what's disconcerting in terms of some of the review evidence and some of what local authorities and health and police are uncovering is that still some of those myths and stereotypes are affecting practice, and particularly how certain groups of children and communities are seen. And what that means is that there's a downplaying of the scale and the impact on children's lives of having been sexually abused in their families. And we see, and this is under the sort of thinking about practice with families and children, too often, lots and lots of what, was always the benefit of hindsight, but too often cues and clues that a child might be being sexually abused is just being kind of dismissed or minimised or just not noticed. So physical presentations to GPs or accident and emergencies, the ways in which a particular family member, maybe a stepfather or a male member of the family, is kind of talking about a child to another professional. schools not really kind of, not questioning why a child's behaviour might be seemingly sexualised. So people just not picking up those clues and cues, but also that this kind of notion about disclosure as an event or an allegation event. So if a child maybe makes a disclosure at school about something that may have happened to them, then there's a sort of Section 47, an investigation, and the child decides, for all sorts of reasons that we understand, to retract that. That's a phrase I wouldn't necessarily use, but to retract that allegation, then everything closes down, rather than seeing actually the process of being able to open up and trust and disclose, often in a very gradual way. I think, it's been certainly my experience of working with children. This may take time, and people need to have that trusted relationship. So that kind of pattern of sort of, episodic referral-driven practice actually really gets in the way of enabling children to speak. Thirdly, this downplaying of risk about adults where there are historical concerns that they may pose a risk to children, sexual risk to children. And I'm not going to kind of talk about the evidence in the National Review, but it is certainly the case that we see a lot of reviews where the person who at the end of the day has been, hopefully been arrested as with charges about having perpetrated abuse, actually they were known to pose a risk. Sometimes having been convicted, might be in another part of the country or another family, or certainly there have been previous investigations. And so there's that downplaying of the risk about adults. And then perhaps most importantly is not having that integrated, joined up picture of what's happening to a child. So the school might have a bit of information, the GP, the social worker, but we don't all join that up and really ask those difficult and thinking the unthinkable types of questions about what's going on. And then not really thinking about what kind of support we offer, not just children, but also their non-abusing parents. And then also we see too often not having the use of what I call good process. So one of my sort of beefs really is the lack of good strategy meetings where people sit down and talk about the evidence that they've got and share and think through, including with, too often paediatricians are left out of the strategy equation, really planning together how we're going to kind of manage and undertake this investigation. And then the multi-agency working being too often siloed. And one of the things we're going to be looking at in this national review is the role and input of the criminal justice system. So not just police, but also probation, who I think, and I'm really pleased about this, are really kind of coming back much more into the safeguarding space, having sort of been, for all sorts of reasons, kind of removed much away from that in a way that I think has really been to a detrimental effect of practitioners and children. And making better use of the different expertise that a probation officer, as opposed to a paediatrician or a police officer or a social worker, can bring. So those are some of the things that we've seen in the patterns of practice that we see in reviews. And these are things that local areas are coming up with as the blockers to good practice and good protection. Thank you. So the review we're undertaking, so just a reminder about the background. So, Cleveland inquiry, which was such a watershed moment, and actually after it, and I'm reading a fascinating book at the moment, which is going back, written by somebody called Beatrice Campbell, going back and looking at the Cleveland kind of inquiry and, what we've learned and not learned since then in terms of what was being said and thought at that point. But it was a watershed moment, and actually it ushered in some really positive changes. So I was showing with some colleagues earlier on today that when I was a team manager working in Bristol in the 90s, I and all of my team would go on 2-week training joint training with police officers from the child protection teams and the paediatricians, and we worked together around our different roles, how we interviewed children, how we helped children disclose, or how we gathered the evidence and so on. That's a lot of that practice has just kind of withered on the vine in a way that I think has been very detrimental. There have, of course, been the inquiries around, it says Rochdale, sorry, I must have a senior moment then, Rochdale and Rotherham, which, of course, you know, garnered a lot of attention and still does in terms of child sexual exploitation in a way that really shone a difficult but such an important light on that particular group of children. And then ICSA, which we've already referenced, and then Everyone's Invited, which was that sort of campaign around really focusing on peer-on-peer kind of abuse. But what that's meant is, apart from Cleveland, the focus in the last 20 years has been very much on institutional-based abuse and extrafamilial abuse and sexually harmful behaviour amongst children and young people, including increasingly online. There's been much less focus in recent years on sexual abuse in the family environment. So my hypothesis is that as a consequence, the second bullet point there, there's been this kind of hemorrhaging of system knowledge, confidence, capability around responding to sexual abuse of children in their families. And I suppose it's kind of interesting to reflect on why that is. And Glenn and I were talking about this and comparing, contrasting Britain and America just last week when we met online to prepare for this session. There's something about kind of, when you're talking about abuse in residential homes or in residential schools or even in terms of extrafamilial kind of abuse, you can sort of other it. It's like out there. When, of course, when we're talking about sexual abuse in families, we're talking about in our own communities, in our own family networks. And as I remember somebody saying, writing back in the 90s, something about sexual abuse is extremely democratic. You know, it affects every single community. So I think there is a little bit of me that still believes that there's a little bit of that societal denial, really, and reluctance to really engage with sexual abuse, which I think affects us all as, you know, as a safeguarding system, as safeguarding professionals. The mandatory reporting legislation, which is obviously going through the Parliament at the moment, is kind of interesting because in one sense, it maybe will help to sort of bring some of those issues into light in terms of the new responsibility. Of course, there are some real worries that, you know, some of us had about the sort of consequences for children in terms of whether that may make it more difficult for some children to disclose. But so that's a bit of a kind of, you know, we need to keep an eye on that. But just going back again to this sort of system knowledge and confidence, I think a lot of the research findings are, and there is a lot of great stuff coming out, including from the Centre's expertise, but somehow it's not landing in terms of practice. So we decided to undertake this review because, as I've already talked about, seeing quite a lot of reviews. I mean, we meet every fortnight and we read about 30 reviews. Every fortnight we will see a significant number of children who have been sexually abused and in their environment, including foster placements. So we commissioned a scoping study to try and sort of look at what the broad patterns were, and then on the basis of that have decided to conduct this national review. Which has been commissioned from our lead review is commissioned from the Centre for Expertise, Social Abuse, who are here at the conference. And we've got two research review questions. So the first is, what are the specific challenges which feature in the identification, assessment and response to sexual abuse in the family environment? And how can multi-agency, because that's our sort of sine qua non really as a panel, how can multi-agency, local and national safeguarding practice change to better reflect the evidence? Because I think what we're essentially seeing is that despite all that evidence and despite past work, lots of really good work by researchers, policymakers and so on, there is this kind of disjunction between what we know and what we see in terms of the quality of practice. And so what we're looking at, how can we help the system, practitioners and leaders in that system, national and local, better protect children at risk of sexual abuse? And so there are two bits to it. One is about, what do we know about identification of risks, the quality of assessments, and the strategies that we have, including about managing risk when children are spending time with people who are known, they may not have always been convicted, it has to be said, but known to pose a sexual risk. And then secondly, how can we more robustly respond to allegations or suspicions to better protect children? And then through that, looking at the sort of interaction with other vulnerabilities, including children who have special educational needs, interactions with particular factors relating to particular communities, faith, race, ethnicity, interaction with other forms of maltreatment. Because one of the things that we have seen is, so for example, I can remember quite recently, a case where a child actually had been referred in because of neglect, but actually when these children were removed from their homes, then started disclosing about sexual abuse. So there is that kind of interaction with other forms of maltreatment. And then what factors mask sexual abuse that will sort of inhibit practitioners from identifying and responding. So we're doing case analysis, I think sort of 100 and something cases, interviews with the practitioners involved in a small sample of those cases, looking at the literature, looking at the other evidence, to really come up with sort of, what are the kind of key themes around contemporary practice in this area, and what do we want to recommend? And we had an interesting discussion earlier on about recommendations from reviews, and we're really clear, we're not going to produce 98 recommendations. Probably it'll be about, we try and keep below the double figures, but things that will really make a difference, impact at a local and at a national level. And I don't know, we obviously don't know what those will be. And we will publish later this year, and those recommendations will be both to government and to local safeguarding partnerships. And the sort of primary aim really is to, I think, equip and better support practitioners in, all the agencies who work to safeguard and protect children. Because at the moment, the conditions in which they're operating is not actually enabling them to do their job. So we want to think about what are the levers. Is it training? Is it policy and practice? Is it procedures? Is it government policy? I don't know. That's what we will be looking at. But to come up with some really strong levers to really help us address some of those problems in the patterns in practice that we see, which too often doesn't actually help and protect children. We also want to talk about the good practice, because there is some really good practice around. And I mean, practitioners, whether it's from health, social work, the police, who've gone so far to really be by children and support children in a relationship-based way to help them talk about what's happening, and then to make sure that the right steps are taken to protect them and their wider families. So that's it, and that's how you can sign up to the panel mailing list, or how you can find out if you want to contact us. So I think it's a kind of watch this space, but interested in any of your reflections when we get to the discussion after Glenn has spoken. Thank you.
Before we go offline, has anyone got any burning questions now for Annie? One here.
Yeah, no, that was absolutely fascinating and really encouraging that this is happening. Very excited to see what very excited to see what you come up with. I just wanted to flag up, you mentioned that you were going to be basing this on case studies. That's one of your main strands, and I just wondered around how you were getting those case studies, because sometimes we know that this is very shadowed, and then there are particular forms of intrafamilial abuse that are even more shadowed, and so we don't actually have the case studies. So it's this murky world to be looking into, isn't it? And I suppose just if you had any reflections on that, and my particular bugbear here, I guess, is organised abuse linked to the family, where there has, I'd argue that's maybe the most shadowed form of child sexual abuse, including kind of ritual elements and trafficking. And so I just was hoping that will be that may not be coming up as particularly prevalent because there are so many barriers, even more barriers for victims of that kind of abuse to disclose. And I just wondered how you were therefore going to ensure that would be under your spotlight and still included.
So, I mean, I think the evidence base in terms of the reviews and the cases that are being looked at, there is an inbuilt bias because they are the cases that have been notified, so that it is which have met the threshold of serious harm, unlikely to be death, but serious harm in terms of working together. I think there's some evidence about this that there's probably a class bias in that sample because, but it's difficult to know how you get around this, that children who come from certain socio-economic groups are more likely, because of other sort of vulnerabilities or adversities in their families' lives, to sort of, if you like, have involvement with, for example, children's social care. So I think there are intrinsically some biases, and we know from other evidence that, for example, in terms of ethnicity, that there are some groups, some Asian groups which may be underrepresented. So I think there are some biases, and we are trying to kind of recognise that. Your point about a sort of shadow of organised abuse, I think, I don't know every single one of the cases. There could be some of those. Well, probably won't be a lot, but I know that we have had some case reviews presented to us which have involved, if you like, kind of intergeneration and across within one family or one sort of extended family, extensive abuse. So that those may well be part of it. But I think we can only look at the evidence that we have. But through the kind of round tables and through the other discussion and the other evidence that we will have, I hope that we will at least be able to kind of recognise the impact of those biases or that sort of distortion and skewedness, if you like, and just make sure that some of those other issues are not lost.
Yeah, absolutely. And it might be that literature, for example, that has interviewed adult survivors can help
Yes.
correct some of those
Yes.
biases. So,
Yes. And that, yeah. Absolutely, and that there is an important kind of thread throughout of all of this of engaging with adult survivors, but also as part of the work we may be talking to some children as well. Okay. Oh.
Thank you, Annie. I've spent the last 3 years working with Ian Critchley in his role as MPCC lead, obviously now with you at the panel. And I'm asking a question really that I know doesn't have an answer, but obviously as we've worked to implement those, as those reviews have been published and working with police, and so often, like, and the point that you raised there about the one that's going to be published around this, everybody having different pieces of the puzzle, and that just every time and time again, that issue of people either don't realise the significance of the information that they hold, or they don't know how to meaningfully share it when in and of itself it doesn't meet any statutory threshold to take any action whatsoever. And it's my opinion, but can you ever see a time where we will work to one data solution? Can you ever see a way whereby we will be able to put those pieces together so that everyone can see the puzzle, rather than continually be saying, how do we get people to recognise that they hold a significant piece? Because in my experience, even when they do, you can't do anything with that one piece. You need... I'm throwing a problem at you there, Annie, but I'd be interested in your opinion as to what you think the solution is to that.
Okay, and I'd be interested to hear what, Glenn, because this may resonate within your context, Glenn. So I think, there is talk now, isn't there, about, unique child identifiers as part of it. Certainly at least one party's got it, I think, potentially in their manifesto. So there is quite a lot of discussion about it in some of the national voluntary organisations. Now, that for me, that has some potential, but actually at the end of the day, it's about our behaviours as professionals. I think yes, the data is important, but even when, as you say, the data is in front of us. So I think this is about how we work together. And so one of the reasons why we proposed, and now being trialled and tested, you know, the kind of multi-agency child protection team concept, a bit like we have of youth around youth offending, is about bringing people with different expertise and, you know, with access to different information systems into one team to certainly respond to children who are at most at risk of significant harm. That's not going to be a panacea, but it may actually help people to work together in a more coherent, integrated way. But I think there's things we can do with the design of the system, and data is probably part of that. But I think it's also about a kind of mindset. We interviewed Herbert Laming when we were doing the Child Protection in England report, who, of course, he did the Victoria Colombier report back in 2002, whenever it was, 1999. And he said, you know, a professional said, you know, if only I had known about the significance of this bit of the information, I would have acted differently. So I think we have to the behavioural change is about people thinking about, so if you're a GP and you're presented with a 5-year-old who is, you know, coming in with certain kinds of physical conditions, you think, is this something I need to be worried about? Is there some other question that I need to be asking? Do I try and find a way? You know, it's just actually, it's about the behaviours that I think are the most crucial thing, ultimately.